Dr. Evans, thanks for taking my call regarding Mrs. Albright, 72, whom I referred to you last week. Her abdominal pain has persisted.
Yes, Mrs. Albright. We initially suspected diverticulitis, given her history and the left lower quadrant tenderness. Her CT scan was somewhat equivocal, showing some wall thickening but no clear abscess.
Precisely. The concern is, while the pain did improve marginally with antibiotics, it hasn't resolved. She's now reporting intermittent nausea, and her appetite remains poor. What's more, she's lost nearly 3 kilograms since I saw her last month, which is concerning. The inflammatory markers are still mildly elevated.
Yes, Mihira, that weight loss is indeed a red flag. When I examined her, the tenderness was less localized, more diffuse in the lower abdomen. We considered irritable bowel syndrome, but her symptoms are far too acute and persistent for that. Given the inconclusive CT and her ongoing systemic symptoms, particularly the weight loss, I'm now leaning towards a diagnostic laparoscopy. I think we need a definitive look.
I concur. My worry was always that we might be missing something more insidious.
Exactly. While diverticular disease is common, her presentation isn't entirely typical for uncomplicated diverticulitis, especially with the weight loss and persistent constitutional symptoms. It's about ruling out anything more serious definitively. Mihira, I truly appreciate you sharing your feelings with me. It's completely normal to feel this way, especially when you're facing something new like surgery. I want to reassure you that hernia repair is a very common and safe surgical procedure. We have an incredibly expert surgical team here at the hospital, and they perform these operations frequently with excellent outcomes. Please know that you'll have a lot of support available to you, not just during the surgery itself, but also before and after it. We'll make sure you're comfortable and well cared for every step of the way. Now, part of ensuring everything goes as smoothly and safely as possible involves what we call a preoperative assessment. The main purpose of this assessment is to ensure that you are in the best possible health and are fit for surgery. It helps us to identify any potential risks that might be unique to you, like if you have any other health conditions we need to be aware of. By gathering all this information, we can then plan for the safest procedure possible, tailored specifically to your individual health needs. Does that make sense? Do you have any other concerns or questions about the surgery itself or this initial assessment that we could talk about?